everybody, hope you guys are all well. It's Marion, and we have a wonderful patient here that has a bit of fungal infection and a lot of lifting of the nails. So we're just gonna look at that lifting there. Can you see? It's not really attached. So what things can cause lifting of the nail? A, damage of the nail bed, B, warts underneath the nail bed, fungal infection, trauma. So many things can cause lifting of the nail bed. So what we're doing today is we're going to remove the nail. And we already put local anesthetic on, so you shouldn't really remove a nail without local anesthetic, because it's all about pain management, right? You want the patient journey to be nice and comfortable. So removing a nail with a local anesthetic is just plain evil. But I know sometimes in accident emergencies, I hear from many patients that some doctors remove nails without local anesthetic, and they're like really traumatized from that situation. Just push the cuticle back, and that helps loosen up the nail plate from the nail root. Some people's nail roots are really far down, some are superficial. So once you loosen it up, it's really easy just to remove the nail. And then easy job to pop the nail out. Voila! So what we can see is the nail is removed, just like that. We can see that there's a lot of damage there. There's different levels of the nail bed, so we're going to clean that up later on. So what we're doing here is there's a bit of damage, so we're just going to clean that out, even everything out. So Sarah, when you practice, holding a scalpel blade, you hold it like a pencil, yeah? And then you have fine movement, and use your wrists. You can move your arms up and down. A lot of people, podiatrists, because they use kind of fine and they get like cramps and pain in their wrists. It's probably an occupational hazard for becoming a podiatrist. Bit of damage to the nail, but just smoothing all that out. Leave it here by a secondary intention. What we're going to do is just look at the root of the nail. Make sure that all of it is nice and clear, so we have a lot of damage. Here, to be honest. So wait and see what happens with that. So again, a little damage, thickening toes. You just feel a little bit of sharpiness, but I'm not doing surgery on that one. I'm doing surgery on the next one. So I'm going to lean on to that one. So like that. Thank you. It is very tricky. Yep, it's not coming out in one piece. So we can see how damaged the nail is. Lots of damage. Make sure we clean all of that. So there's still some nail in here. Fifth toes are tricky because they're under a lot of trauma, so that's why it's so hard to predict if they're going to come back normal or not because of the pressure from the footwear. And then with that toenail, the nail clip's so lifted from the nail bed. You know, it's been like this for years, so we can't really predict versus something that's flat and intact. So that's the thing about medicine. Sometimes we want the best for the patient, but naturally the body heals in a very strange way. So we cut back some of the top tissue just to create like a nice foundation so that the nail plate can grow out. Just apply that. Real life, and also when you film it, so you put a small nail in here. You see? And that can harbor infection. And the fungus can go there. So always double check and triple check. I'm happy with that. Let's irrigate, please. And that's here. Excellent, thank you. Okay, so we just removed 2 toenails. Can you make an up time for me, please? Thank you. Thank you. Excellent. Excellent. So taping the foot, you just want to kind of have a lot of, you don't want it too tight because that will add pressure onto the wound. So move the foot up and down, make sure it's a little bit mobile. Excellent. That's all done.